Good morning, viewers. Our today's discussion will be on what high blood pressure is and how to prevent it. Generally, everyone would like to have healthy or normal blood pressure, but what exactly does it mean? Basically, each time when the heart beats, it pumps blood into the blood vessels. This creates pressure against the walls of blood vessel. This is called as blood pressure. Normally in healthy person, it rises and falls throughout the day, but when blood pressure remains high for a longer time and left untreated, it can lead to serious health complications. In general, persistent increase in blood pressure higher than normal blood pressure is known as hypertension. Now, high blood pressure usually develops over time. It can happen because of unhealthy lifestyle choices. For example, not having enough regular exercises or physical activity, obesity, smoking, and stress. There are other risk factors that can also increase the risk of developing hypertension, such as age. As people get older, the arteries become stiff and narrow. This increases the resistance of blood vessels and blood pressure rises. Family history of high blood pressure. One or more close family members with hypertension increases person's risk of developing hypertension. Excess salt intake is also known to raise blood pressure. Not eating enough foods containing lot of potassium in it can increase blood pressure and thereby the risk of stroke and other pressure related complications. Eating processed and fatty foods increase fats throughout the body, make the heart work harder to push blood through the body, hence causing blood pressure to rise. Another one is stress. Reacting to stress in unhealthy ways or not managing stress can also increase blood pressure. Moving on, hypertension doesn't have any obvious sign symptoms in most of the cases. That is why it is often called a silent killer. It puts people at risk of several diseases from cardiovascular problems to kidney failure, stroke, and even eye damage, and is one of the leading cause of acquired blindness. Moving on, hypertension does not have any obvious sign symptoms, I told you. Hence, early and accurate diagnosis is very important in the management of hypertension. Measuring the blood pressure is the only way to diagnose high blood pressure. No symptoms or signs can prove that it is due to high blood pressure. A sphygmomanometer can only tell that he is a patient of high blood pressure. Generally, when symptoms do occur, they include morning headaches or tiredness, some visual problem, buzzing in the ear, fatigue, nausea or vomiting, etc. If person is experiencing some of these symptoms, then one should get their blood pressure checked immediately. Fortunately, high blood pressure can be easily diagnosed by an instrument called sphygmomanometer. A blood pressure is recorded in two numbers, systolic and diastolic. Now let's try and understand what do these numbers mean. A healthy normal blood pressure should be less than is equal to 120/80. Here the upper number indicates the systolic blood pressure, which means pressure in the blood vessels when the heart pumps, when the heart contracts. Whereas the lower number indicates the diastolic blood pressure, that means the pressure of blood within the blood vessels in diastole, that means when the heart is not pumping, that is the time in between two contractions. If blood pressure level is more than is equal to 140 by 90, then the person have hypertension. If person have BP levels higher than this, then he might at risk of developing serious heart diseases and other complications like stroke, kidney disease, eye problems, etc. This risk can be prevented and be reduced by taking steps towards a healthier lifestyle. They are regular exercises, healthy diet, quit smoking, regular blood pressure monitoring, stress management, and adherence to medicine. If blood pressure is successfully controlled with such lifestyle modifications, then it might avoid medicine intake, or it may delay drug intake, or may reduce the need of medicines. So let's take the strategies one by one. Regular exercise or physical activity. Exercise can be a drug-free approach in lowering high blood pressure. Regular physical activity makes person's heart stronger. If one have a strong and healthy heart, it can pump more blood with less effort. So if heart has to work less to pump, the force on the blood vessel will be decreased and lowers the blood pressure. And over and above this, exercises cause dilatation of blood vessels, which reduces the resistance within the blood vessels, thereby lowers the blood pressure. Now, regular exercise also helps in maintaining healthy weight, which in my opinion is a very important way to control blood pressure. One should aim for at least 30 minutes of aerobic exercise in most of the days in a week, at least 5 days a week. High BP level can be reduced by doing regular structured exercises such as brisk walking, jogging, swimming, cycling, etc. Don't lift weight. Lifting weight is not aerobic exercises. Now, healthy diet. Diet also plays important role in controlling blood pressure. A diet with a high intake of vegetables, fruits, whole grains, not refined grain, is recommended for hypertensive patients. For lowering blood pressure or preventing hypertension through dietary intervention, one can adopt a dietary pattern. It is called DASH diet or a Mediterranean diet. DASH stands for Dietary Approach to Stop Hypertension. That means to eat lot of fruits, green vegetables, whole grains always, low fat dietary products, and to consume less amount of saturated fat and cholesterol, which can lower one's blood pressure by even up to 11 millimeter of mercury if having high blood pressure. And there are other important points like plenty of potassium rich food should be taken, which can prevent rise of blood pressure, and limiting the amount of sodium in diet. Now, reduce sodium in your diet is very important. Even a small reduction in the sodium in diet can improve the heart health and help in reduction of blood pressure by about 5 to 6 millimeter of mercury if you are a patient of hypertension. To decrease sodium in your diet, you can consider tips like read the food labels in purchased food containers and beverages so that you can consume foods with low sodium alternatives. Eat fewer processed foods because they contain lot of sodiums in most of the cases. And don't add salt in your diet, extra salt. Just one level teaspoon of common salt has 2300 milligram of sodium in it. So avoid adding salt to food. You may use some herbs or spices which may add some flavor to your food instead of adding salt. Quit smoking is very important. Stopping smoking helps your blood pressure to return normal, and cessation of smoking can effectively reduce the risk of heart disease and improve your overall health. This is a very, very important factor which can reduce your blood pressure just simply avoiding it. Now, regular blood pressure monitoring is very important. Some of the hypertensive patients check their blood pressure by visiting doctors only. But it is not always possible for patients to visit doctors and check up their blood pressure. Hence, most often I advise my patients for self-monitoring of blood pressure. Self-monitoring of blood pressure helps in measuring his blood pressure frequently and over a long period of time, and by which a doctor in his visit can learn his high blood pressure scenario, which is very important in the management of high blood pressure for that patient. Now, stress management. By learning how to relax and manage stress can improve emotional and physical health, which can lower blood pressure effectively. Now, stress management techniques include exercise, listening to music, focusing on something calm or peaceful. Not the least is meditation. Even 15 minutes meditation in a day can relieve stress to a greater extent. Now, adherence to medicine. This is very, very important for those whose blood pressure is not controlled adequately with lifestyle modification only. A medicine to lower blood pressure may be recommended by doctors only. If your blood pressure is considered high, usually more than is equal to 140/90, adherence to medicine is very important as it controls your blood pressure regularly. Blood pressure medicine should not be stopped other than the advice of your doctor. At last, I would like to suggest that there is nothing more precious than having a fit and healthy life. Adopting healthy lifestyle can make you healthy and can gift you a long life. Keeping blood pressure in the normal range is very important in preventing cardiovascular complications and other complications like stroke, kidney disease, and eye problems. It is very much possible to maintain normal blood pressure levels with regular monitoring, preventive care, and adherence to medical treatment if required. Thank you very much for your patience hearing.